Welcome to Ortho Reports. Today, we've got a really fascinating story of medical innovation that was, well, kind of born out of necessity. It's all about a super clever off-label solution for some of the absolute worst leg fractures you can imagine, and it was all recently put to the test in a prospective study. So first off, I want you to picture a really severe leg fracture. I'm not talking about a simple crack here. Think about a high-energy injury, maybe from a bad car accident, that just shatters the shin bone, the tibia, and does massive damage to all the muscles, skin, and tissue around it. It's a truly devastating injury, and for any surgeon, it's a huge challenge.
And here's the core of that challenge. For that shattered bone to heal, it has to be held perfectly still, perfectly lined up. But with all that damage to the surrounding tissue, the risk of infection is just way too high to go in and put a plate on the bone internally. So the question becomes, how do you build a super stable frame on the outside of the leg without basically trapping the patient inside a giant clunky cage?
That very question brings us to the traditional way of doing things and all the problems that come with it. Let's dive into our first section: a nasty break, a bulky fix. For years, the standard approach was what's called a conventional external fixator. And really, you can think of it like a big set of scaffolding built around the leg. It's huge. It has to span all the way across the knee and the ankle, locking them both in place. Now compare that to the innovative idea we're talking about today, a low-profile plate that acts more like a brace. It's still incredibly strong, but it's way less intrusive, and that means more comfort and, crucially, early movement of those joints. And you can imagine the very real human cost of that bulky scaffolding. Because it locks up the joints for so long, patients often end up with terrible joint stiffness, and their muscles just waste away. And beyond that, the frame itself is just, well, it's a pain. It's uncomfortable, it makes something as simple as putting on pants a nightmare, and it can even bang against the other leg when they're trying to walk. It makes for a really tough road to recovery.
But what if there was a better way? This brings us to our next section, thinking outside the skin, which is where a brilliantly simple but really powerful idea comes into play.
So here's the genius of it, this clever, off-label solution. Surgeons took a device called a metaphyseal locking plate, which is this strong, contoured plate that was designed to be screwed onto the bone inside the body. And they had the idea to use it on the outside of the skin as a much less invasive external fixator. It's a complete repurposing of a tool they already had.
And this really shows why it's such a fantastic idea. See, the locking screws create this incredibly stable connection because they thread into both the bone and the plate, making a rigid, fixed-angle structure. But the plate's low-profile design means it sits pretty snugly against the leg, making it way more comfortable. And here's the real game changer. It doesn't need to cross the knee or the ankle. This lets the patient start moving those joints early, which is huge for recovery, and it still leaves plenty of room for wound care.
So an idea is one thing, but does it actually work for patients with these awful injuries? Well, that's exactly what a new study set out to prove, which brings us to Section 3, putting the plate to work. Researchers in India set up a prospective study to find out. The whole process was pretty straightforward. They took 16 patients who all had these severe tibial fractures. The surgeons went ahead and applied the internal locking plate externally, just like we talked about, and then they followed these patients for 9 months, carefully tracking how the bone was healing, any complications that came up, and most importantly, how well the patients were getting their function back.
So, the big question: what did they find? This brings us to the evidence, and we're going to break it down by the numbers. Let's take a look at the data. With any broken bone, the single most important number is healing time, right? Well, in this study, the average time for these shattered tibias to fully heal was 19.7 weeks. Now, to put that into perspective, that's just under 5 months for one of the worst types of leg fractures to heal completely. For such complex injuries, that is a very solid result. Of course, no procedure is completely without risks. This chart breaks down the complications. So out of the 16 patients, there were 3 cases of malunion, which just means the bone healed but in a slightly off position. There were 2 cases of non-union, where the bone didn't heal and needed another surgery. And finally, 2 minor pin tract infections, which is a common risk with any external device. So not perfect, but these rates are definitely comparable to the traditional methods.
But here's the really compelling part. How did the patients actually do? How did they feel? Well, this chart on their functional outcomes tells the story. A stunning 69% of patients had an excellent result, with another 12% rated as good.
If you do the math, that's over 80% of these patients having a great recovery, with little to no pain, stiffness, or limits on their daily life. That's a fantastic outcome.
And this right here highlights one of the biggest reasons why they did so well. Patients were able to get their knee almost perfectly straight, and they could bend it, on average, over 107 degrees. This is the key benefit of not locking the joint in that big, bulky frame. Preserving that range of motion is absolutely critical for walking, climbing stairs, and just getting back to a normal life.
Okay, so let's put this all together. Section 5, a new tool for recovery. What does all this mean for the future of treating these injuries?
The study's authors offer a really important learning point here. They basically emphasize that this technique isn't magic. It takes a ton of surgical skill. You have to get the length, the alignment, and the rotation of the bone just right before you apply the plate. That careful prep work is absolutely essential for getting a good outcome.
So, what are the big takeaways from all this? First, this method is a totally viable alternative to those big, bulky fixators. Second, it offers much better comfort for the patient, which usually means they're more likely to stick with their recovery plan. Third, it lets them start rehab earlier and keeps that all-important joint motion. And finally, it all hinges on meticulous, careful surgical technique. And that leaves us with one last big thought. This whole journey started with a really clever, off-label idea, just using a tool for something it was never designed for. The question the study raises is, could this accidental innovation one day become the new standard of care for these devastating injuries? It's just a powerful example of how thinking differently can truly change patients' lives for the better. Thanks for joining me for this Ortho Report.